Welcome to Vet Candy, where we talk about the hottest vet news. Thanks for joining us today. We are super excited to be here. I'm Dr. Michelle Moyal, an assistant clinical professor at the College of Veterinary Medicine at Cornell University, and I focus on primary care surgery.
And I'm Patrick Carney, an internist epidemiologist and also assistant professor at Cornell. My teaching focus is on primary care.
And on this episode, we will be talking about the pandemic pet boom.
One in two dog parks have worms? Interceptor Plus is a monthly chew that protects your dog from not only heartworm disease, but all 5 major worms. Test dogs for heartworm infections prior to use. Reported side effects include vomiting, diarrhea, and lethargy. Interceptor Plus. Ask your vet today.
This program is approved for CE credits. Check out the notes below for details. If you enjoy this video, be sure to like and share. And don't forget to subscribe to this channel to stay up to date with everything vet med.
An estimated 23 million American households acquired a pet during the COVID-19 crisis, causing an all-time surge in caseloads to veterinarians like ourselves across the nation. 1 in 5 American households adopted a dog or a cat during the pandemic. So, how can we make sure all of those animals are fully protected? What should our new pet protocol be?
These are all really good questions, and I think we're still struggling with the answers. So, I think one of the first places to start is that the increase in animals also corresponded with things like curbside appointments, and we saw that efficiency plummeted. So rethinking how we utilize our teams, making sure that we have appropriate staffing ratios, really letting people do their jobs and make sure that everybody's job is optimized is a great place to start.
I think it's so interesting that efficiency overall seemed to fall. I found that a lot of vet clinics really liked curbside because it allowed them to utilize their staff by, bringing in a patient, doing what they needed to do, having them go back to the owner, and then they can talk to them, when they're leaving. And so for some, I thought that they were able to see more appointments, but I think the caseload was just so overwhelming. It still kind of overwhelmed our staff and the needs of all of the clients.
Yes, and I think part of it may also be that it was just a struggle to connect with our clients. So lots of phone calls, but missing that kind of personal touch that really makes some of those appointments rewarding.
I think there's a lot to be said for veterinarians' interpretations of histories in person when we're talking to clients, right? Reading that body language. I don't know, sometimes that you're exactly right. I just feel like sometimes that in-person contact led to them sharing more. Yes,
I think that's very true.
And so we definitely missed out on that. So what I would tell you is it seems to me, and you can tell me if you agree with this, that first visit with that new pandemic pet is integral to success for this protocol.
Yes, I agree 100%. And a lot of those new pets probably belong to new pet owners. So what do we need to tell people when they bring that new puppy or kitten in for the very first time if they've never owned a pet before?
100% on the news. And what I think is the issue here is we're used to, seeing new puppies, just talking about vaccines and preventatives, which of course is still really important in this case. But maybe we need to talk to them about things as simple as feeding appropriately.
Right. We know that obesity is an epidemic, but there is also really kind of an explosion in different diets. So we have concerns over grain-free diets and lots of information that may be conflicting online, lots of really strongly held opinions. So we need to really be able to establish ourselves as a reliable, trusted resource for these people that are really kind of social media savvy, internet savvy, and are looking for information in multiple places. How would you recommend we really establish that bond with our clients?
Gosh, and there are so many online sites that I've had clients go to, and not only did I have to spend time on giving them my recommendations, but I've almost had to spend the same amount of time or more kind of countering what they've read, because unfortunately some of those sites are not steering clients quite where we want them to be.
Yes, I think we've all had that experience.
And so in practice, I started getting used to handing out a list of trustworthy sites, meaning AHA, things like that, AVMA, sites that I thought were really reliable for owners to find resources and information to follow up on my recommendations.
Right.
So I gave them the recommendations and I'm like, here, do your own research. However, myfirstdogbaby.com is not where I want you to look up your info, right?
Right.
I want you to come to us. The other thing I really think a lot of these new owners were struggling with is not quite anticipating the costs of care.
Yes.
And so I was just reading something, and again, you can tell me what your thoughts are, on an owner unfortunately adopting, what she thought was a cute lab puppy at 4 or 5 weeks of age, adorable. She had to do all this work with this puppy, and now it is a full-grown 100-pound dog that this owner maybe didn't anticipate the full cost of what just feeding alone would be for this dog. I think she feeds, 12 cups, 8 cups a day, and is running out of food at the 3-week mark. That's a fair investment.
It really is, especially with some of these super premium diets that are available now. So if somebody's feeding that, they may not have anticipated that cost when that puppy was 8, 12, 15 pounds. It takes a lot of food to feed a 100-pound lab. One of the things I really run into a lot in internal medicine, but also in primary care, is food allergies. So we see it manifesting as chronic gastrointestinal disease. We see it as chronic dermatologic disease, the foot lickers, the ear infections. And diet trials and dietary management is the keystone for that. Some of those hypoallergenic, hydrolyzed, novel protein diets are extraordinarily expensive. And if you have a Chihuahua, a Yorkie, it's probably not going to break you. But if you have a Great Dane, an Anatolian Shepherd, that's when things tend to get really expensive. And
even some of these diets that people are finding in the pet stores are quite pricey. They're reading these ingredients, duck and cranberry and sweet potato, sounds so lovely. The other battle we're kind of fighting, and you may again feel the same way, is I feel like when I first started as a doctor, all we had to fight with was dog food versus raw food. And we were talking about the pros and cons of both. But now we have home-cooked diets I get this sponsored on my, social media feeds. Obviously, I'm researching things. But all of these diets now that you can order that come in packages or frozen and you can feed to your food. So it's a lot of education on our part before we talk to the client.
It is. And this is all really early on in the relationship with the client. So being able to establish that trust really quickly so that they're willing to accept your recommendations is really, really critical for that.
I absolutely agree, because I think that most vets have encountered what I've encountered, talking maybe about a diet not being, AAFCO certified, right? We would love a governing body to say that some of these diets are at least somewhat complete. And a client looking at me saying, you must make a fair amount of money from those food companies. That's just unfortunately not how it works.
Right. So one of the things that is potentially helpful there is having a discussion about the pros and cons of the diet and really listening to what the client's concerns are. And I think the good thing for the purposes of this discussion is that we're talking about people that are new pet parents. And it's that period of time when they're probably most willing to accept suggestion. So somebody that's been feeding a really unusual diet for 10 years, they're really invested in that. You're probably not going to have any success convincing them. But, often it's, I'm new to this. What are your recommendations? I'm thinking about this kind of diet. That's when you have the most chance of kind of persuading them to listen to what you have to say and at least take that into account when they make their choices.
Absolutely. And I'm going to urge all doctors, new and old, that if you don't know what a diet specifically is, it's okay to say to an owner, oh, wow, there are a lot of diets out there. I would love for you to give me some information on that diet so I could do more research and make sure it is perfect for your pet.
That's great advice. I think we see this a lot working with our students here. The student will come back and tell me that a dog is on a certain diet, and I've never heard of it. I ask the student if they've heard of it. We don't even know if they've written it down correctly. So it's really helpful to try and track down exactly what they're feeding, make sure you agree with what the nutrient profile is. It's appropriate for the breed, the life stage. Really common one, giant breed dogs that aren't being fed a large breed puppy formula. So making sure you know what they're being fed to try and head off problems down the line.
Yes, same thing. And again, hopefully this is not too controversial. Sometimes those all age diets or all life stages diets, for me, are a little bit hard for puppies to be eating, right? I'm a firm believer that puppies have additional nutrient requirements, just like seniors do. So I'm not commenting on it. Some of these diets are great quality, I'm sure, but it is up to you to do the research and to help your client make sure that that's okay for their pet.
Right. And I think trying to put it in terms that might allow them to relate to their own life can be helpful. So if they're trying to feed in all life stages food to a really young puppy, kind of say, is it normal for a human baby to be eating the same thing you are when they're 3 months old? There are nutritional differences as a human ages, there are nutritional differences as a pet ages. So using kind of really easy to digest comparisons to something that the owner may have more experience with as a new pet parent may be helpful.
Absolutely. I think this nutrition topic is super important, but again, incredibly confusing to clients and some veterinarians. I mean, there are breed-specific diets out there. Right? Like food specifically for German Shepherds and so there's just an incredible variety. So what I would tell you is, if you don't know, it's okay to tell them, we're going to look it up. And them talking to their friends or their neighbors, again, align with the client, tell them that's wonderful that they were asking people, right? Because we can't get anywhere for our patients if we become combative, and tell them you're going to do some research, and together as a team, you'll make a plan and decide on nutrition.
Right. I think part of that, which you really highlighted there, is admitting that we don't necessarily know all the answers. That is probably one of the fastest turnoffs for a client. When you try to come across as knowing everything, that's when they suspect you may be trying to spin them one. So being open and honest and learning to say, I don't know, but let me find that out for you in a way that inspires confidence in your client is one of the most important communication skills that we can try to teach our vet students.
Absolutely. It's okay to say, I don't know.
Yes.
Love that. So let's talk about other things for our protocol. So we spoke about nutrition. We're trying to warn them about the cost of some of that care. Obviously, there are cute things out there now, right? Bark box. I totally get it, right? Cute toys.
Right.
So people are paying for these monthly subscriptions, and that's really novel when they have a nice, young, healthy puppy. But the goal is to anticipate the cost that could come later.
Right.
And so, in my mind, obviously talking about vaccine schedules, cost of care that way, cost of emergencies, cost of dental care. How do we get that across in such a short amount of time with our clients?
It's a challenge, and some of that may come down to giving them resources that they can read on their own at home. So is there a trusted website that lays out this information? Can your clinic come up with handouts that provide some of that information that really is upfront and open about your fee structure? That can be really beneficial. And then places like AVMA and AHA have handouts that also do a really good job of laying out, what does a vaccination protect against? What's a vaccination protocol look like that's really client-facing, and that they make readily available to clinics.
Agreed. The other thing you might consider thinking about, which many vets may not think about that first visit, is, hey, do you ever plan on traveling with your dog? Right? One, we want to make sure they're protected for where they're going. But two, based on where they're going, there may be additional requirements, paperwork that can be costly, travel certificates that can be costly, right? So I've had people try to get on flights with animals, with their pets, their like loved pets that they want to carry on the plane. And I've had to break the news to them. Unfortunately, your pet is not going anywhere with you because we need to update their vaccines. Right.
That's a big one. And the travel, as an epidemiologist and an infectious disease guy, travel always makes me think, what could they come home with? So keeping that in mind when they return from that trip to Arizona, right? Dog starts coughing. I usually don't see coccidioides, but if I know it traveled, suddenly I'm going to have to start thinking about a whole new suite of diseases. And as international travel becomes more common, we're going to be talking about really unusual for the United States infectious diseases potentially cropping up as well. So always keep that travel history in mind and prep the owners well in advance. Even, as you said, early in your relationship with them, hey, are you thinking about traveling with your dog or cat? Where would you be thinking about going? These are the concerns I might have, and this is how we can best prepare for that scenario.
Absolutely. I worked in California for many years, and I saw diseases I never saw here, or even really talked about a lot as a student because they just weren't prevalent.
Right.
And so super duper important to bring up these things. I think the goal of good vet care is to anticipate what could happen on behalf of the client so they have good expectations and then they are not upset when things happen that we could not control.
I think that's a great way of looking at it. And I think that's what we've been kind of nibbling around the edges. So much of establishing that relationship is establishing expectations early on, really laying out the groundwork so that the owner knows what to expect, not just during this appointment, but as we go forward, so that it doesn't feel like you're springing surprises on them. And once they trust you, every once in a while I'm going to forget to have talked about something, but we have that relationship where hopefully all is forgiven if I drop the ball occasionally.
So we have, again, we're reviewing our protocol. So we have a new puppy in the household. We have reviewed their history. We've anticipated some of the things that they could encounter based on where they're from. Good veterinarians are doing fecal tests. They're testing for heartworm. Obviously, we're staying on top of that. So we talk to owners about vaccine schedules. We talk to them about preventatives. We're trying to talk to them about cost of things. We're trying to talk to them about future travel. But is there more?
Oh, there's always more.
I'm sure there's more.
And all of this is getting crammed into 15 minutes, 20 minutes, 30 minutes. These puppy appointments, I think, are some of the most challenging ones to see, even though it's often a happy, healthy pet, because it's so information dense. So we still need to touch on behavior and training. So that one for me, it is really important to know if the owner has had a pet before, because in some circumstances that means you can shortcut, right? Oh, we've had a dog before. Maybe I don't need to have the full discussion. But I always am a little bit cautious when it comes to behavior and training in particular, because that's one where I find the question, have you had a dog before? That doesn't, if they say yes, it doesn't mean I can skip the training, because often the way they train dogs is not what would be ideally recommended. So those are the people that may actually have established bad habits that we need to kind of break down and have a good discussion about positive reinforcement, making sure that you're not rewarding bad behaviors, make sure you're not punishing bad behaviors as well.
And even as a veterinarian, I lost my elderly dog, a year or so ago, and then got a young dog. And I forgot training, right? And so even as a professional, I forgot training. And so I think that this is hard for veterinarians. There are a lot of expectations on us for our first puppy visit. We have to be all of these things. Right. And so I think we have to try to anticipate ways to figure out to offload some of that from that veterinary visit, because we're also trying to focus on the main, like the physical exam and all of those important things, right? Orthopedic changes and things like that.
Right. And that comes back in part to making sure that all of your staff are on board and have a say in helping clients with this education. And then maybe trying to spread it out over multiple visits. So as long as they're looking like they're coming back for that puppy series or kitten series, maybe your first visit is the diet talk, maybe your second visit is the spay and neuter talk, and just parcel it out and do things that we know work for effective communication, like chunk and check. So don't give a long speech to your client, give them a piece of information, and then ask them to, in some way, tell you what they just heard to make sure that everybody's on the same page. And that in turn is going to reinforce it and kind of cement it in their memory. Absolutely.
I can't even talk to I'm thinking about what you just said, and I can't even talk to my parents about large paragraphs of information with habit and allow them to actually swallow it and digest it. And so small chunks are the way to go. And it's the same thing. By the way, this conversation is very similar for cats as well, right? I think a lot of people think that cats, and again, this doesn't even matter if they're pandemic cats, that once they're home, if they're not sick, they don't need to go to the vet.
That's true. And we see that reflected in the numbers every time somebody looks into it. Cats absolutely have lower rates of visits to veterinarians on an annual basis. So a lot of people, if your cat doesn't have an illness, it's not going to the vet. And we know that preventive care is just as important for the cats as it is for the dogs. They get parasites, they get heartworm disease, all of these things that we may not be thinking of as commonly in cats, they're still at risk for, and they still benefit from having somebody take a look and make sure that things are okay.
I wonder if it would help. Sometimes we see a lot of dog owners at the vet that have cats, or at our hospitals that have cats, and we've never seen them.
That's true.
So I think we should definitely consider, and a lot of us have this on our welcome to the practice sheet, like what pets do you have? How old are they? But I think it's something we should consider making sure about, right? And then when someone's making an appointment, we say, hey, we haven't seen, your cat Fluffy in a while. Like, how about we make it a double appointment, right? So obviously we're focused towards increasing business, but again, the goal is patient care.
Right. So one of the things that tends to hold people back with cats is also the fear that the cat is stressed or really doesn't enjoy veterinary visits. And I totally get that. And it's true that cats don't enjoy veterinary visits kind of across the board. But there are things we can do to make it better. And I think the profession has really made enormous strides in the last few years, maybe 10 years, in making feline visits friendlier, making sure that we really are aware of the ways that we can minimize feline stress. So really emphasizing that culture in your hospital goes a long way towards helping your patients and probably making sure that you see more feline visits.
I think if it's something you do at your practice, you should be advertising that. Like, I think cats are definitely a resource that we could tap into, not only for visits. I know a lot of vets are overwhelmed, but I think it's just as important to see them, right? Plus, as cats get older, there's tons of OA, arthritis in them that we're not catching, that owners don't recognize. And so I think these are the things we're hoping to catch early before they cause an issue.
Right.
That's it for this episode of Vet Candy. I'm Michelle Moyal.
And I'm Patrick Carney.
Thanks so much for joining us.
Not all preventatives protect your dog from heartworm disease and all 5 major worms, leaving a gap in their coverage. Close the gap with Interceptor Plus. Test dogs for heartworm infections prior to use. Reported side effects include vomiting, diarrhea, and lethargy. Interceptor Plus. Ask your vet today.
Hi, I'm Shannon Gregoire, and welcome to Vet Candy, the destination for everything vet med. Launched in 2019, Vet Candy has grown from a weekly email newsletter into a modern veterinary lifestyle brand and an indispensable resource for the best veterinary education. Let me show you around our website, myvetcandy.com, and show you how to keep up with everything vet med. First, let's check out our homepage. We have some great stories to keep you up to date on the latest clinical updates, scientific news, and expert lifestyle tips. We also celebrate amazing people who are making our world a better place. This is my favorite part. For those of you that are looking for exciting veterinary CE, look no further. We have some great stuff for you, and I promise, no PowerPoints and no webinars because we do things differently. Maybe that's why we have more than 1 million views. Now let's go to CE On Demand. Here you will find videos that are all RACE, New York State, and CPD approved for veterinary education credits. Vet Candy is the streaming platform where veterinary professionals can learn from the world's most exciting experts and top influencers. Stream anywhere, anytime, and at your own pace. What I love most is that our videos are studio quality, shot and edited in 4K so you can stream them in 1080p. And best of all, Vet Candy's entire collection of more than 75 continuing education videos can be streamed anywhere, anytime, for free. And you can also select up to 12 different languages to watch them by selecting the language of your choice in the subtitles. So, how do you get your CE credit after watching an eligible video? It's simple. All you need to do is watch the video and then pass the quiz. Click on the Take Quiz button. This is the button below the video that takes you to an online test. When you pass the quiz, you will instantly receive an email with a PDF with your certificate of completion. It really is that easy. Next, we have a variety of Vet Candy original shows, from talk shows to rounds and games. There's something for everyone, and we are committed to bringing in diverse voices and unique perspectives. Let's look at our master courses. We have 4 master courses right now, and more are coming soon. We have ophthalmology, which is taught by veterinary ophthalmologist Dr. DJ Heusler, toxicology, taught by criticalist Dr. Carrie Hemmelgarn, surgery, taught by board-certified veterinary surgeon Dr. Philippa Pavia, and respiratory disease, which is taught by Dr. Anthony Gonzalez. For our master courses, there are 8 modules for each course. Watch each module and then click on the link that says Take Quiz, and it will take you to an online quiz. When you pass the quiz, you will receive your certificate of completion of the course, plus a link to download some tools to help you celebrate and share your accomplishments. You just click on that link and it takes you to the tools. So that's it for the tour of Vet Candy. I hope you enjoyed it and thank you for watching.